Okay, so we're looking at, this is kind of a close-up of looking at the right knee from the side. The first thing that we can see here is you can kind of see this change in coloration, a little bit lighter in color here, a little bit wispy. So that's some joint effusion, that's inflammation within the joint. It's not terribly severe. I could probably say it's moderate, mild to moderate. These little guys aren't supposed to be there. So
Yeah,
those are kind of joint mass. I think that may represent mineralization of the meniscus. So if the meniscus was torn, or it could be a mineralization at like right here where the insertion of the cruciate ligament would be. So those aren't supposed to be there. And then if you look at kind of the surrounding structures, the kneecap here, a little bit roughened coming off of the end of the kneecap. These fabellae back here are a little bit, those should be kind of more smooth and round. They're a little bit pointy.
What are those again?
Fabellae, they're just two little accessory bones in the back of the knee. I couldn't even tell you what their purpose is. But anyway, all these changes are consistent with degenerative joint disease or arthritis of the knee. And the most likely cause of that in a 100-pound lab would be a tear of the cruciate ligament. So I think that's most likely what's going on. And I think it's probably time to start thinking about surgery.
Is that a condition that has he had the torn ligament for a while? Do you think, or just
It'd have to be there for a little bit for those changes to show up. Weeks,
okay?
Months. And a lot of times it's not necessarily like we see in human athletes where they plant their foot, turn wrong, and snap it. A lot of times it's more of just a degenerate, kind of a chronic wear and tear, and it causes that ligament to give way. If we look at his hips look good. So I don't see any evidence of any sort of hip arthritis.
Oh, that's good.
We can see close-ups of, kind of head on at the knee in this view. Not a great way to look at the knee, but I can still see arthritic changes, and I think I can see arthritic changes in both knees, which makes me a little bit concerned that
they look different.
What was that?
some of that's just positioning.
Okay.
But again, we're kind of seeing, so this would be the right knee here. We're kind of seeing some these surfaces should be nice and smooth and round. They're a little bit bumpy, getting a little bit lipping coming off of the the medial and the lateral portions there. And I'm even seeing the same changes in the left knee. So I think he probably has cruciate disease in both knees. It's just one at this point in time is more symptomatic than the other.
And you recommend surgery?
I do, because I think that's the only way that we're going to stabilize the joint and prevent formation of arthritis. He's a year and a half old. If you feel like, you anticipated lifespan is going to be 12, 13, 14 years, that's 12, 13, 14 years for that arthritis to become much more severe.
And what's the next step as far as getting surgery?
Well, so you can do one of two things. We have a traveling surgeon here, so